CPT JJ-CPB, Introduction, page 12, part 15.
Selection of procedure, continue.
Continue, yeah, we're talking about the selection of procedure, right? When advanced practice nurses and physician assistants are working with physicians, they are considered as working in the exact same specialty and exact same subspecialties as the physician. Okay?
Yep.
So we have divided this into just lines so you can understand better, right? So the first one is advanced. Can you read it?
Yeah. Advanced practice nurses.
When the advanced practice nurses and
physician assistants.
These two groups are working with.
They work as physicians.
Then these two groups are considered the same specialty as the physician. That's what it says, our theory, right? Okay, so now this is our theory for today, and now we're going to do the problem. So ready, set, go. Okay, CPT JJ-RVA, page 269, exercise 148, and this is a level 1 exercise, and it reads like this.
Surgery, auditory, modified radical mastoidectomy.
Right. This is the surgery section of the CPT book. Is the auditory, means the ear. It's a modified radical mastoidectomy. Okay. So we're going to count to 3. So you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay. The answer is 69505. Okay. If you got that, congratulations. If you didn't get it, let's give you a couple of tips. Okay, the tip number 1.
Number 1 is start with mastoidectomy.
Start with mastoidectomy. You know that ectomy is an excision, and it's taken out, right, of the mastoid, right?
Right.
So you start with mastoidectomy. Okay, and tip number 2.
From all the subcategories under mastoidectomy, the only one that has radical modified is mastoidectomy with tympanoplasty. So choose that path.
Right. When you're in the index and you found already mastoidectomy, you read all the subcategories, right? And the only one where you can find radical and modified is a mastoidectomy with tympanoplasty. Now, tympanoplasty is not in the definition, but that's the only way that you can get to the other words. So you have to choose that one because that is an indication of where to go. So choose that path, right? Okay, so these are the tips that we have, and the answer is 69505. So we are going to count to 3, so you can pause the video and give us the path to the answer. You already know the answer, but we want you to give us the path now, how we got to the answer, okay? So 1, 2, 3. Okay, this is the summary of the whole problem. It's a surgery section of the CPT book. It's the auditory or the ear. And the procedure is a modified radical mastoidectomy, right? So there's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to mastoidectomy.
You start with mastoidectomy. And
then with tympanoplasty.
With tympanoplasty for the reasons that we explained on the tips. And then you go to
radical.
Radical, and then you go to
modified.
Modified, and you get a code next to it, which is
69505.
That's the code that you get from the index. Now we're going to check this code in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Go to the tabular.
Then you go to 69505.
Since you only have one code, go exactly to that code, right? It's numerical, so you'll find it easily under the 69. So 69505. And what do you read there?
You get mastoidectomy modified radical.
Right. There's a mastoidectomy and there's a semicolon there, right?
Yes. Because
there's other things, but in the semicolon is where you divide. And then underneath that, you're going to find modified radical, which means exactly a definition, what the procedure that we have. So that's why we have the equal sign at the end, which means that we double check this code. So the answer is 69505. Okay? So that's our video for today, and please remember to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos. Right,
just click in the subscribe letters in red that Nelly's definitely pointing there, and then you'll be subscribed to our videos, right? And what did I get?
You will get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so don't forget to visit our website and to subscribe to our videos. Thank you.
Goodbye.
Goodbye.